Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on pathophysiology of disease, cellular adaptations, each with 4 answer choices and detailed explanations. Vignette 1, Hypertrophy. A 38-year-old man begins an intense weightlifting regimen. Over months, his muscle mass increases. What cellular adaptation is most responsible? A. Hyperplasia, B. Hypertrophy, C. Metaplasia, D. Atrophy. B. Hypertrophy. Explanation. Skeletal muscle fibers increase in size, not number, in response to increased workload, a classic example of hypertrophy. Vignette 2, Hyperplasia. A 25-year-old woman becomes pregnant and shows glandular proliferation in her breast tissue. Which cellular process is occurring? A. Metaplasia, B. Hyperplasia, dysplasia, D. Anaplasia. Answer B. Explanation. Hormonal hyperplasia is a normal physiological response to estrogen during pregnancy, increasing glandular epithelium. Vignette 3, Metaplasia. A 60-year-old male smoker has a biopsy of his bronchial mucosa that reveals squamous epithelium instead of columnar. What is this change called? A. Dysplasia, B. Neoplasia, C. Metaplasia, D. Hyperplasia. Answer C. Metaplasia. Metaplasia is the reversible change of one differentiated cell type to another due to chronic irritation, such as smoking. Vignette 4, Atrophy. An elderly woman has been bedridden for 6 months after a hip fracture. Imaging shows smaller quadriceps. What process explains this? A. Dystrophy, B. Atrophy, C. Fibrosis, D. Apoptosis. Answer B. Explanation. Disuse atrophy is the reduction in cell size and number due to decreased mechanical stimulus. Vignette 5, Pathologic Hyperplasia. A 50-year-old man has benign prostatic hyperplasia. Which of the following best describes this process? A. Increased cell size, B. Increased cell number, C. Dedifferentiation of cells, D. Cell death. Answer: increased cell number. Explanation: BPH is a classic example of pathologic hyperplasia, a non-neoplastic proliferation due to hormonal stimulation. Vignette 6, Barrett esophagus. A patient with GERD undergoes endoscopy. Biopsy shows non-ciliated columnar epithelium replacing squamous in the esophagus. What is the diagnosis? A. Dysplasia, B. Metaplasia, C. Neoplasia, D. Hyperplasia. Answer B. Metaplanation. Barrett esophagus is a form of intestinal metaplasia due to chronic acid exposure, a risk factor for esophageal adenocarcinoma. Vignette 7, Dysplasia. Cervical biopsy reveals pleomorphic cells with hyperchromatic nuclei and increased mitotic activity but no invasion. What process is occurring? A. Neoplasia, B. Dysplasia, C. Metaplasia, D. Hypertrophy. Explanation is disordered growth and maturation of cells, a potentially reversible precursor to malignancy. Vignette 8, Compensatory Hyperplasia. A 35-year-old man donates a kidney. After several months, his remaining kidney increases in mass. Which process is responsible? A. Hypertrophy only, B. Hyperplasia only, C. Hypertrophy and hyperplasia, D. Atrophy. Answer C. Hypertrophy and hyperplasia. Explanation: compensatory growth involves both hypertrophy and hyperplasia in organs like the liver and kidneys. Vignette 9, Hormonal atrophy. A postmenopausal woman has a thinning of her endometrial lining. What is the most likely cause? A. Increased estrogen, B. Chronic inflammation, C. Decreased hormonal stimulation, D. Ischemia. Answer C. Decreased hormonal stimulation. Explanation: endometrial atrophy after menopause is due to lack of estrogen stimulation. Vignette 10, Irreversibility. Which of the following cellular changes is considered irreversible? A. Cellular swelling, B. Detachment of ribosomes, C. Membrane damage, D. Nuclear clumping. Answer C. Membrane damage. Explanation: once plasma or lysosomal membrane integrity is lost, the cell undergoes irreversible injury and death. Would you like to continue with vignettes on neoplasia? Puerto Rico Medical Board-style clinical vignettes focused on pathophysiology of disease, inflammation, each with 4 answer choices and detailed explanations. Nasha? Vignette 1, Acute versus chronic inflammation. A 34-year-old man presents with a sore throat and fever for 2 days. A throat swab grows Streptococcus pyogenes. What type of inflammation is most likely occurring? A. Granulomatous inflammation, B. Chronic inflammation,